Hi, this is Joe Sandusky. This is my persuasive speech. I'm doing it here at the hospital and with co-workers, Dr. France, Velvet, several other nurses that are here tonight. And my speech is on there's a new drug dealer in town, and it's Medicaid. There's an incredibly high number of Medicaid recipients who are obtaining prescriptions with the intent of abusing narcotics and or selling drugs. Medicaid costs an average of $12,000 per year per recipient, and Medicaid costs Americans $225 billion per year. North Carolina has $6.5 billion a year in Medicaid costs, and this is according to the Center of Medicare and Medicaid Services. We all know or have a relative or know somebody who's in need of medical attention, but due to lack of financial resources, they're not being attended to. These people need our help, and the Lord directs us to help these people. But the health care is not cheap, and without insurance, our loved ones suffer. Health care is also not within our government's ability to provide without funding. Health care funding will most likely come from heavy taxation. But I have one source we need to secure funding from, and that's the Medicaid abusers. My purpose here is to convince you to contact your senators, your state representatives, your federal representatives, and voice your opinion to this atrocity. If we ever hope to provide health care to deserving people, we must take Medicaid away from undeserving people. And again, Medicaid is costing $225 billion annually, and we have a subculture of people that are abusing Medicaid just for the sole purpose of prescription narcotics, so they can either use them or sell them. 43 million individuals are on Medicaid. In America, that's 1 in 6 people on Medicaid. North Carolina has twice that rate. In North Carolina, we have 32%, or 1 in 3 people on Medicaid. Medicaid misuse is much more than just the medicine abuse. We see a great number of people who come here for very minor complaints that could have been attended to by a family doctor. And we even have girls who come here just for the sole purpose of having pregnancy tests performed. It's an average of $1,500 to come to an emergency room when they could have went to the dollar store and got a pregnancy kit for $1. So that's $1,499 misuse of Medicaid dollars. So how far would these millions of dollars go to provide health care to deserving people who sat home sick for lack of resources to pay? And again, my main purpose is to state that we have the subculture of people misusing Medicaid just to obtain prescription narcotics. Many people come into their doctor's offices or an emergency room complain about non-specific pain such as back pain, toothaches, headaches, pain that's difficult to diagnose or to find with diagnostic tools. Almost from the beginning of the triage process, these people let us know that they're going to need strong pain medicine such as Percocet or Demerol, both narcotics. And they will list their allergies to Tylenol, Motrin, Toradol, Ultram, various non-narcotic medications, so that we're boxed in to only give them the narcotics that we're going to treat their pain with medicine. When a urine drug screen is ran on these people, we often find opiates, barbiturates, cocaine, methamphetamine in their urine sample. I work full-time at this emergency room and part-time at 2 other emergency rooms, and sometimes I'll see these very same people at all 3 emergency rooms at different times within a short period. And we have the ability to perform a prescription tracking check on the internet, and when we do, we often find these people are seeing multiple doctors, 6 to 8 doctors, and they will run a rap sheet 2 to 3 pages long on the narcotics they've gotten from these doctors over a 12-month period. One recent check that we ran, the person had gotten over 800 Vicodins in a 6-week period. Yet when we did a urine drug screen, she was negative for opiates but positive for cocaine. So she was selling these Vicodins to buy her cocaine with, using our Medicaid dollars. And some people will test clean for everything, and they still have the history of obtaining all these narcotics. So it seemed to me that they are making hundreds of dollars at the cost of our thousands of dollars on Medicaid dollars. Now, prescription abuse is not just the only problem with Medicaid that we see in the emergency room. We see the same behavior come from people who are not on Medicaid. And then we also see, for the majority of people on Medicaid, are on as people coming here seeking true medical attention. However, though, tonight my purpose is just to address the Medicaid abusers who we as taxpayers are supporting. We must correct this offense. These individuals are wasting hundreds of millions of our tax dollars for their own illegal gain, and they must be stopped. We must voice our opinion to our state and federal representatives concerning this atrocity. And our state and federal representatives are our first line of contact. State representatives are more responsive to our contacts because they depend more heavily on our votes. However, it's the federal senators and Congress that we really need to convince. They're the ones who can change the laws and reinforce Medicaid sanctions. I will say this, our government is not unaware of Medicaid abuse, but with all the other problems our elected officials facing, Medicaid abuse has just taken a back burner to it. Medicaid abuse will not become an issue until we as voters make it one. I truly don't believe that our leaders are not concerned with Medicaid abuse. In the past, they've went after doctors and hospitals that erroneously file false claims for services not rendered, and they've recovered millions of dollars. But what I do believe is that they're unaware of how many hundreds of millions of dollars are wasted on actual Medicaid abuse by the other recipients coming to the facilities trying to obtain narcotics. Medicaid has several areas of misuse, and again, I'm only taking this issue to point of the narcotic abuse. And this must come to an end, and what I need is our collective votes, our collective voters to call their representatives to be heard. And again, Medicaid costs $225 billion annually to fund. We have this subculture abusing Medicaid. Without our elected officials in Washington or Raleigh hearing from us, I feel certain that this atrocity will only grow bigger as more people are seeking Medicaid assistance. Here's an interesting fact. There are 5,759 hospitals in the United States. This is according to the American Hospital Organization. And up to $33 billion of the $225 billion is estimated to be being misused by Medicaid recipients trying to get prescriptions and illegal drugs. It's also estimated that only 50 million Americans are underinsured or have no insurance at all. If we were able to take away Medicaid from those caught with illegal substances in their systems and use the money to provide health care for those 50 million uninsured, the best part of that plan would be that after paying for their insurance, we would still have $16 billion left over. And now, in my opinion, that's something that Washington would want to get behind. Thank you.
Yay!
Don't clap. Just turn it off.